You can introduce yourself, let us know where you're calling in from, your name, and then if you'd like any organizational affiliations that you have. But yeah, we will go ahead and get started in just a couple minutes here, but thank you for being here.
Hi, everyone. Hi, Riley and Galaxy, Riley's dog. Thanks for joining us.
Yes, my dog Galaxy is very needy this morning, so I'm sure he'll make an appearance.
Looks like more folks are joining us. Do you want to make the announcement again, Riley?
Yeah, thank you everybody for being here. We will go ahead and get started in just a few minutes, probably like one more minute or so. But this is the personal story workshop, or more specifically, using the story of self in the campaign to win Medicare for all. But yeah, we will go ahead and get started at 10:03. But thank you all for being here on time. All right. Well, welcome everybody again. I think we'll go ahead and get started, and folks can catch up as they trickle in. But yeah, welcome to the Personal Story Workshop at the 2022 Healthcare Now conference. More specifically, this workshop is called the Using the Story of Self in the Campaign to Win Medicare for All. And we will go into what we mean by story of self throughout this workshop. But yeah, this workshop is put on by the National Nurses United, NNU. And for those of you who don't know, National Nurses United, while we do have a robust campaign to win Medicare for all, we are first and foremost the largest union and professional association of registered nurses in the United States. Our members have been waging a decades-long struggle for universal healthcare, single payer, and really working to ensure that healthcare is finally treated as a human right in this country. Nurses are committed to fighting for Medicare for all because every single day they care for patients with incredible passion. And every day nurses see their patients making the grim decisions of having to choose between, which medications they can afford, or whether they should get, this life-saving care that they need, or pay rent, or choose between groceries and other out-of-pocket costs. They experience firsthand how broken our healthcare system truly is, and how their patients do not get the comprehensive care that they need. Nurses know that Medicare for all is the only solution to address the healthcare crisis that we are all facing. So having said all of that, let me go ahead and introduce myself. My name is Riley, and I'm an organizer on the Medicare for All campaign with National Nurses United, and I will be co-facilitating this workshop today. My pronouns are he, him, and I'm calling in from Ohlone land, which is indigenous land, also known as San Jose in the South Bay. And co-facilitating this workshop is my teammate, Alyssa. Alyssa, would you like to introduce yourself?
Yes. Hi, Riley, and hi, everyone. As Riley said, my name is Alyssa Kang. I'm also a community organizer on NNU's Medicare for All team. My pronouns are she, her, and I am joining from occupied Ohlone land, also known as Oakland, California. Great to be here with all of you. Thanks so much for joining us.
Yeah, thank you for joining. If you're on the West Coast in the morning, I guess if you're on the East Coast, we're in early afternoon. But yeah, thank you to those that are introducing yourselves in the chat. Feel free to keep doing that. You can throw your name, where you're calling in from, and any organizational affiliation that you have. But yeah, let's go ahead and take a quick look at the agenda that we have for today's workshop. And this is one of the most fundamental skills of organizing, the personal story. So the goal of this workshop today is for participants to learn about this crucial organizing tool that is really at the center of much of the organizing that we do on the NNU Medicare for All campaign. And it's really, a central organizing tool that you can use on any campaign. Right? We will be learning how to write, and we will actually work on sharing our personal stories today. So a personal story is an organizing technique. I'm going to say this again. It is an organizing technique. When we tell our personal stories to others, we draw on experiences from our own lives to explain why we are called to be a part of a movement for change. We use that story to connect with whomever we're talking to, right? And call on them to join us in the movement. For the purposes of this workshop today, you can imagine yourself as hosting an event for Medicare for All, whether it be a phone bank or a text bank, or just speaking at a rally, right, for Medicare for All. It could also just be a one-on-one conversation as well. And those are sometimes the most effective way to use the personal story. Stories are really central to the organizing and the movement building work that we do at NNU. Anyone who has hosted or attended one of our NNU Medicare for All canvases will have seen how our canvassing script is really built around the idea that exchanging stories about our broken healthcare system, we can then work to create common ground between volunteer organizers and their neighbors. We know that everyone out there has a story about how our broken healthcare system has touched their life in some way. And we believe that this works to sow the seeds for the movement that we need to grow in order to achieve a system that truly prioritizes our health over profit and wealth. Almost all stories have a similar structure, right? When you have a personal story, there's a character, that's you. We have a challenge that you faced, and this was a moment when you had a choice had to be made. And then because of that choice, a new outcome was produced, right, by that choice. And the choice and the outcome together, they demonstrate a moral point or a reason that you took action in the way that you did, right? In a good story, when we're listening, we can empathetically identify with the character and the choices that they make. Therefore, we not only hear someone's personal story, right, or hear the moral choice they made, we also can feel the moral choice they made. We can be inspired by the moral choice they made. The story of the character and their effort to make the optimal choices encourages listeners to think about their own values and their own emotions and what they would do in this situation, right? They think about the challenges that they face in their own lives. And this inspires them with new ways of thinking about how to make choices in their own lives. So some stories invoke emotion, while some stories inhibit emotion, right? Or they stop action. Sometimes emotions, they facilitate or they encourage us to take action. Other times, emotions can inhibit us from taking action, right? Sometimes they move us to act, sometimes they hinder us. Everyone's actions and their feelings are inherently linked. Action is inhibited by some emotions on the left here, like inertia, apathy, fear, isolation, self-doubt. These are all feelings that inhibit action. However, action is, sometimes we're called to action, right? Or we're encouraged into action by emotion. Things like a sense of urgency, hope, solidarity, anger, and even just having a you can make a difference attitude can encourage emotion. We use personal stories to mobilize emotion of action in us and in others to overcome the emotions that are inhibiting us from taking action. This is where the true source of a power of the true source of the power in a personal story. This is where that power can be found. It's our ability to construct a well-constructed story that mobilizes people into action. Personal stories are not only meant to be told on stage by politicians or to a large crowd. Personal stories are really most often effective in a one-on-one setting and a one-on-one conversation between you and someone with whom you have rapport. You should think about your story this way when you're crafting it today in this workshop. Think about when you would have a conversation with someone about Medicare for All, or maybe just when you'd have a conversation about our broken healthcare system more generally. Maybe you're at work or a family reunion, or someone shares a story about their experience trying to just simply access healthcare through their health insurance. This would be an ideal time, right? To share your story, to hear and listen to someone else's story, ask questions, connect with it, share a little bit of your own story, and then ask them to join you in supporting or even fighting for Medicare for All, right? This is just one example. There are many real life examples and situations where you could use a story to build support for healthcare as a human right. I'm going to share another example of what I mean here. So this here is a video of a member of our union and one of CNA NNOC's board of directors, registered nurse Martise Chisholm. It was recorded and shown at a film screening of A Power to Heal, Medicare and the Civil Rights Revolution, which is an amazing documentary on how the grassroots organizing by civil rights activists, along with the federal government, used the passage of Medicare as a tool to desegregate hospitals across the country in just a matter of months. If you have not seen this documentary, I highly recommend you to go listen or to go watch. But as we listen to Martise's story today, try to pick up on some of the key elements of the story. What emotions does it invoke in you? Where does the motivation lie for Martise? Where does the courage come from? Where does the hopefulness come from? What does this story compel you, or how does this story compel you to take action? I'm just going to go ahead and make sure that my volume is working here really quickly. Sorry about that. Share sound. All right, hopefully this will come across.
I am Martise Chisholm, a California Nurses Association and National Nurses United board member. You've heard how Power to Heal describes how the mass activism of the civil rights movement was also fundamental to passing Medicare, and how it took the work of those same activists to enforce the crackdown on hospital segregation. For me, this history is personal. My great-grandmother, Bertie Kegler, was a civil rights activist and a powerful freedom fighter in Mississippi. She worked with the Student Nonviolent Coordinator Committee, SNCC, knocking on doors on the creek, because that's where Black people homes and shack were, to register them to vote. In January 1966, she went to Jackson, Mississippi to give her testimony with 4 other civil rights activists about the rampant voter suppression she had witnessed. On their way back home, the Klan forced their car off the roads, and my great-grandmother and another civil rights activist were murdered. I was only 5 years old, but I still remember her funeral. The seed she planted in me as a child has encouraged me to fight for justice since then. I honor my great-grandmother by organizing for Medicare for all and by caring and advocating for my patients every day, by engaging in activism through my union to address the racial disparities in our healthcare system. We know that the job of confronting racial disparities in healthcare remains urgent. People of color experience higher rates of otherwise preventable or manageable conditions, including diabetes, stroke, heart disease, and cancer. In a system based on profits and ability to pay, racial disparity is seen in the inability to afford the high costs of premiums, deductibles, and co-pays that disproportionately discourages people of color from getting medical care. Immense racial disparities are also seen in corporate healthcare decisions, such as which hospitals are closed and where new facilities are open, what services are cut, and what patients are denied care by healthcare insurers. Medicare for all will be a huge step forward toward ending racial disparities that are based on income and ability to pay, as well as where you live. The good news is that our Medicare for all legislation goes further. It provides targeted funding for new facilities, major equipment, and medical staff personnel in medically underserved areas. It bars discrimination, including reduction of medical service from any medical programs. It would require reports to Congress on identifying and evaluating racial disparities and discrimination in healthcare with recommendation for further actions. Racial disparity in healthcare are the direct legacy of slavery, post-emancipation, Jim Crow segregation, and ongoing structural racism. Enactment and enforcement of Medicare for all, a vital piece of legislation, is in all our hands. It will be a major step forward in repairing the brutal damage of 400 years of racial discrimination in healthcare. Julia Bond, who co-founded SNCC, the Student Nonviolent Coordinator Committee, said, "Good things don't come to those who wait. They come to those who agitate." Thanks again for being part of this historic struggle.
Ooh. Woo. Sorry about that. Whoa. Okay. Wow. I always mess that transition up. But what an amazing personal story, right? I mean, it's hard to listen to Martise's story and not be drawn in with how powerful it is. I want to welcome folks to type in the chat one word or emotion that you felt while watching Martise's story. This really is a great example of sharing a personal story. And really, it's a good example of sharing one in a setting in which you are asked to present for a longer period of time. It's almost impossible to imagine anyone not being moved to take action after watching Martise's video. But yeah, it's truly inspiring and very moving. So thank you, those folks that are typing stuff in the chat. I'm going to pass it now at this point over to Alyssa, who's going to go into a bit more detail about the components of a personal story. So I'll pass it over to Alyssa.
Great, thank you, Riley, and thank you, Martise, for your story. It truly is really powerful and moving. I've heard it multiple times, but every single time it's still so impactful. So there are three main components for how we teach personal story. This, as you can see on the slide, the story of self, the story of us, and the story of now. And each of these different components on their own tell a slightly different story. But for today, we are going to be focusing primarily on the story of self. So the story of self can be a triumphant story of overcoming one's obstacles, or a story of how we transformed internally as a result of not doing so, of not overcoming an obstacle, and how that internal transformation empowers us to commit our lives to social justice. It focuses on why you are called to join a movement or political struggle, and illustrates it by sharing an experience from your life where you overcame a challenge. And even if you didn't overcome the challenge, the deep emotional impact of that challenge, perhaps how it ingrained a firm lifelong commitment to activism in you. Think, for example, about Martise's story that we just heard, right? Think about how Martise has politically alchemized her deep anger, her rage and pain from when she was a young girl, and how decades later, she is still fighting for social justice as a union and nurse leader and a Medicare for All and healthcare justice advocate and activist. So during this workshop, we're going to solely focus on the story of self, but I'm going to just briefly explain the story of now and the story of us. So the story of us tells a compelling story of why all of us together are effective and are collectively in this struggle. The story of now ties all these elements together and reveals why the listener should take action now. Woven together effectively, these three components create a personal story that builds a bond with the audience that's listening, invokes emotions that overcome inhibiting factors that Riley went over, and moves us to take action together now in this moment. As you can see, this isn't just about telling your life story, but it's about sharing a personal experience and perspective. And it's also about tying that into your pitch, so to speak, to others about why it has moved you to take action and why they should take action with you in as concise a way as possible. And remember, you'll use these stories to help build the movement for Medicare for All when you're speaking to your family, your neighbors, your coworkers. And you want to end up with a story that you feel confident sharing with those groups of people and in those types of spaces. If you tell them your life story for 10 minutes, you probably won't move them or inspire them to take action with you. They'll probably be confused, possibly, about why you are sharing so much information about your life and about yourself. And they may even get bored and tune you out, which we obviously would not want to happen. Good stories are efficient. They get to the point, they help people to quickly draw a connection to you, and most importantly, they encourage others to take action. So again, we'll focus on the first component, the story of self, during this workshop. A story of self explains why you have been called to serve. I'm going to say that again. The story of self explains why, the reason why you have been called to serve, to take action, for example, to take action in support of Medicare for All and to join this movement. We have all made choices that shape our life's path, how to respond to challenges we faced as children, whether or not to take leadership roles in our places of worship, our workplaces, in our communities, where we found the hope to take risks. This key focus is on choice points, moments in our lives when our values become real and when we have to choose in the face of uncertainty and adversity. When did you first care about being heard, about abuses of power, about poverty, about the injustice of our healthcare system? Why did you care about these things? When did you feel you had to do something about it? Why did you feel that you could do something about it? What were the circumstances? The power in your story of self is to reveal something about yourself and your values, not about revealing your deepest, darkest secrets, but the key shaping moments in your life. We all have stories of pain, or we wouldn't think the world needs changing. And we all have stories of hope, or we wouldn't think we could change it. But our goal when telling the personal story, our personal stories, is to take our pain and these experiences and use it as hope, use it as a catalyst for ourselves and for others to take action. So here are some prompts to help you start thinking about as you start putting together your story of self, right? Some prompting questions. Think about a challenge in your life. Why did you feel it was a challenge? What was so challenging about it? And why was it your particular challenge? Think about the choice you made in response to that challenge. Why did you make the specific choice that you did? Where did you get the courage to take action? And where did you get the hope? Where did that come from? And how did it feel to make the choice that you made? And finally, what was the outcome of that choice? How did the outcome feel? How did it feel? Why did it feel that specific way? What did it teach you? And what thing do you want to teach others? And how do you want others to feel? These are all questions you can reflect on when you craft your own story of self. In just a few minutes, we're going to share a worksheet you can use to put together your personal story. And the prompt questions that I just went over and that are on the slide have been included in the worksheet as well. So just to wrap things up for this section before I pass it over to Riley to go over the worksheet and the breakouts that we'll be heading into, we covered the three main components of a personal story, primarily story of self, and also story of us and the story of now. The story of self, again, is the foundation. It is where the main components of the rest of your story will build from. And to, some other questions to think about again. What challenges brought you here, right, to this movement, to this conference even? What choices did you make when you decided you wanted to organize for healthcare justice and to take a role in fighting for Medicare for all? So remember, the goal of a personal story is to motivate others to join you in organizing and support of winning Medicare for all. I'm going to pass it now to Riley to get us started on this worksheet that I've referenced, and also the breakouts that we'll be heading into. So take it away, Riley.
Great, thanks, Alyssa. Yeah, and thank you for leading that section on personal story. So I just want to note here that there are a lot of ways to teach personal story to activists and organizers. In fact, there are even whole theories and whole books written on the power of personal story. So if you are interested in learning more about this topic, please do feel free to send us an email, which Alyssa just put in the chat. Thank you. And yeah, we would be happy to connect you to more resources. But with that, I'm going to go ahead and take a moment here to screen share this worksheet so that you all can take a peek at it. And then we'll go over the instructions for the breakouts, and we will go ahead and execute those breakouts. Let's see here. Okay, so here is the worksheet. It gives you some structure for how to think about your personal story. And you will see at the top here, there are some instructions. So really quickly, if you have a Google account, When you open up this worksheet, to make a copy, you'll go to File and then Make a Copy. This is if you have a Google account. If you do not have a Gmail account or a Google account, you'll just go a little bit further down here to Download, and then you can download it as a Microsoft Doc or a PDF or whatever is best for you. But yeah, in any case, this worksheet, you'll notice that we have some prompts down here. Ask yourself to find the challenge and the choice and the outcome. So please do go through this worksheet and fill out each question before writing your personal story. We really want you to try and identify what is the challenge, right? What's the structural challenge in your story? What was the choice that you made? What was the outcome of that choice? And what moral point does this choice demonstrate? Or what do you want the listener to know, right, about your choice and your story? And then lastly, what you'll do is take all of those elements kind of combined to create your personal story, and more specifically, your story of self. But don't feel confined to these questions too. Sometimes they won't be as clear, and that's okay. Ideally, this should be about how you became involved in the Medicare for All movement. But if you have a more compelling story that's different than these prompts, please feel free to write that too. And then once you jot down, your all three answers, we will come back into the main group. We'll have about 5 minutes in the breakouts for this particular worksheet. I'm gonna go ahead.
5 minutes to write, not the breakouts, right?
Yes,
yeah.
Yes, not during the breakout. Sorry, yeah. Hold on one sec. So here are the instructions for the breakouts, and we will put this in the chat for you as well. So first, when we head into the breakout rooms, you want to introduce yourselves. So spend about 30 seconds introducing yourselves. We'll put you in groups of about 3, I think. You'll spend 30 seconds introducing yourself, share your name, location, and any organizational affiliation if you have one. And then we will spend about the first 5-7 minutes of the breakouts filling out the worksheet together, sort of silently. And you can write down in the worksheet, you can make a copy of the document. You can also just write the questions down on a sheet of paper and answer them that way if you'd like. But yeah, we'll spend about 5-7 minutes working on the worksheet, and then we will send a prompt out into the breakout rooms, and then you'll spend the rest of the time sharing your personal stories with each other. We expect that with the amount of time we have in the breakout, about 20 minutes, that 3 minutes about per person is about right. So try to stay under that 3-minute mark. But yeah, that is what we will be doing. And I think Alyssa just put yes, thank you, Alyssa.
I think we're going to have people work on the worksheets in the larger room, right, for 5 minutes.
And
then we'll send them to the breakouts.
Yeah, we can do that. Yes, that'll give me time to set up the breakout rooms too. So we'll all stay here. So feel free to open that sheet. We'll spend the next 5 minutes working on it together here, and then we'll pop you all into the breakouts.
Yeah, and we're not going to play music. We'll just have silence. You can concentrate on filling out your worksheet. But if you have questions, feel free to put them in the chat, and we'll answer them in the chat. Okay, welcome back, everyone. Thanks for hopefully that was you found that helpful. Today we talked about the story of self, explaining why we personally have been called to act and to join this movement for Medicare for All. And every one of us here I believe, has a compelling story to tell and to share. We've all made choices that shaped our life's paths and has led us to take on leadership roles and organizing roles in this movement for healthcare justice. So we hope that you found the breakout session in this workshop helpful. And we also hope that you feel even more equipped to go back into your communities, your workplaces, your organizing spaces, or just any opportunity that arises to share your personal story and to make an ask that person you're talking to join you in the Medicare for All movement. Because really, that is what organizing is, right? Just regular everyday folks like ourselves, having conversations, making connections, and building relationships, and doing the organizing work as part of larger movements for justice, and that we're doing that together. So with that, I know many of you have some pretty compelling and powerful stories related to healthcare and why you've been motivated to take action. So we have some time before we wrap up, so we can get a few, we love it if we can get a few volunteers to briefly share your personal story. So if you're willing to share, please go ahead and raise your hands. We're asking that you try to keep your stories between 1 to 3 minutes long so that we have time to hear from a few people. And also, this is a good practice for keeping our stories concise and focused, right, and to the point. So if you'd like to share your personal story, go ahead and raise your hand, either by using the Zoom feature, right, or you can even raise your hand. I see already someone, and we'll go ahead and call on you. So why don't we start with, I'm going to check to see if you raised their hand. Radel, you should be able to unmute yourself, and please go ahead and share your story with us. Thank you.
Good morning, everyone. So my story is that I had been married, and my wife had, at the time, had insurance for the kids, and I was able to go out and be self-employed and blah, blah, blah. So we ended up getting a divorce. I ended up with 2 of the kids. And as a result, I lost my insurance because she was the one that had the insurance. And so I was, well, I'm not going to say forced, but I ended up going on public assistance in order to make sure that the kids had insurance, medical insurance and dental insurance. And as a result of that, I got hell from my family about why the heck am I doing public assistance, you know. Anyway, that was the other story. But anyway, I ended up looking for a dentist because the dentist that I had already told me that he had his plate full with people that, you know, were not paying, I guess, not the full share, but I guess they don't get paid like if you were in a private insurance. So anyway, I called other insurance, other dental offices, and I got the same story. So I finally came back to the original dentist that we've had for years, and I said, hey, look, you know, just insure my kid, or just take my kids. I'll pay you out of my pocket if you would. And he said, yeah, sure. So that's how we worked that out. But that just goes to show you that if you're transitioning from one place to another, you know, it could be from one job to another, and you could lose your insurance in any time. And then once you do, you know, you're pretty well screwed because you don't have insurance. And if you have kids, that's even worse. You know, I mean, if it was me by myself, I wouldn't care. But, you know, I had these kids that I had to worry about. And so anyway, that just kind of shows you too that the system is kind of a for profit, because if you don't have the means and you're too poor or don't have the finances, you pretty much are left out there without any insurance, and you have to find a way. And unfortunately, a lot of us, you know, end up with state insurance or public health or whatever, and they don't ever pay the premium price that they want to get. So that's the other thing, because right now I just came from working from the city, retired, and had good insurance to having Medicare. And I see that problem in the Medicare system also. So anyway, that is a story. That's my story.
Mm-hmm. Oh, thank you so much for sharing that, Rodell. And I think, I mean, and also I feel like, you know, what you're talking about, I think will definitely resonate with anyone else you talk to about what you experienced, and encourage them to take action, because I think people very much have the similar stories to share, unfortunately. But yeah, does anyone have any thoughts or want to share anything or give feedback? Or
Yeah, thank you, Raul, for
and
sharing
also
that.
let's give some emojis and, you know, some love
Yeah.
for Rodell, you know. in the chat and also reactions.
Yeah, thank you all for sharing that. I think it's a really good story. It's clear what your choice and your challenge was, right? You were faced with like shifting insurances and trying to manage that. I think that's a really a universal problem that exists for anyone who gets involved with our healthcare system. And that is, we didn't get into this today, but that's the story of us that you would tell in your personal story, right? How anyone could be affected by this. I think the one component that you could work on with this story, and this, we didn't get into this today, so no worries, but it's the story of now, which is really about the reason about why, when someone's listening to this, what's the next step? You want to make an ask of them to join you in the movement, or say, and this is why I'm fighting for Medicare for all, and this Medicare for all would fix these problems that I've been facing, and this is why I'm fighting for that system. And that sort of like nicely ties the whole thing together. But yeah, great job, and thank you for sharing.
Yeah, no one should have to choose between getting care for themselves or or their loved one, right? And yeah, for sure. Or lose the coverage too. So for sure. Yeah, but thank you. Oh, it looks like Marjorie has her hand raised. So,
Hi, mine is a little bit of a different story, so I thought I'd share it.
sure.
And I'm a member of Actors Equity Association, and we have great health coverage when we're working, but we are a multi-employer union, and so we have to do things like work 11 weeks to get 6 months of health, or 19 weeks to get a year of health. Not all of us work all the time, and henceforth, a huge percentage of our union is not insured. When we are insured, we have great health care. That's fabulous. But I, as a public policy, part of the public policy committee, am very much involved and want to be more involved in, we have supported universal health care. It's the only way that we are all going to get health care for our members. During COVID, all of us were out of work. All of us lost our health care. Some of it we tried, we adjusted and tried to get ways of doing virtual shows, etc., so some people could stay. But it is a huge part of us, even though I made my living in the theater, but I didn't always have health care. Mm-hmm. So I was very lucky in one way, and on tenterhooks for other parts of the year or other parts of my life. So universal health care is really important. The other part that I will share is that state by state, healthcare doesn't work for us because we're a national organization. And I have to, as a spokesperson for my other members, to tell the members who keep saying, why can't we support New York State healthcare, Seattle healthcare, California healthcare? Because if we do, it will take members from our fund, and it will make our premiums higher for the folks that have to stay. So it's a very layered situation, and it's a personal, I'm on Medicare now and I'm fine, but that doesn't mean I shouldn't care and work for this for the 50 other 1,000 members of my union. So it's a different kind of personal story, but it is a personal story.
Yeah, thank you, Marjorie. I think how you ended it, right? That's the story of us. So you were talking about how you're concerned about healthcare for everyone, right? So that I think that's really important component. And also you make your personal story also makes a really strong argument for why we need to separate healthcare from employment, right? So that no matter what the situation is, whether you're unemployed, whether there's like a massive pandemic that's, resulted in massive job loss, it shouldn't matter. People get the care that they need. And especially during COVID, right? What better argument or case do we have to have Medicare for all for everyone? So yeah, I think thank you for sharing that. And I think, and at the end, right, we always, just have to make sure what is the ask, right? So, as we continue with this organizing, and as you all continue organizing in your communities, that's why I'm urging you to attend our meeting or sign this petition or, come to this event. So, but, great, both of you, great stories to great pitch and hook to get them come to connect with you, and then eventually to root them to join you in whatever organizing that you're doing. So yeah, thank you so much. But yeah, let's show some love and appreciation for Marjorie as well. I'm gonna do my favorite emoji, which is the heart. But yeah, great. Thank you so much. Great job too.
Yeah, I think the employer sponsored coverage of that is like one of the things that will resonate and connect with people the most. Most people in this country, if they've ever had employer sponsored coverage, they probably also lost it at some point. And because people change jobs, that's just the nature
Right.
of work.
Right. Or if you're a student or unemployed or unable to work, that shouldn't be a barrier for you to getting the care that you need, right? So I think that's all the time that we have, though. So thank you so much, Radell and Marjorie, for those for sharing and for those excellent examples of story of self and personal stories. I'm going to I'll just say that on behalf of the team at NNU, our Medicare for All team at NNU, I want to just thank you so much and express our deep appreciation for all of you taking the time to be with us today for this workshop, and for also the organizing that you have been engaged in your respective communities. We hope that you found today's workshop helpful and that you feel confident and motivated to keep honing and developing your own story of self. We hope that it will prove to be a useful organizing tool and technique as you work to recruit more people to join you in this important fight for Medicare for all. So I'm going to pass it now to Riley to close this out. But yeah, again, thank you all so much.
Yeah, thank you, Alyssa. So yeah, I'm going to close this out here. I'm going to show the last slide, which is just our action slide. So these are all the different ways that you can take action with our campaign. We wanted to just leave you with this. So first, we want to let you know that soon we are going to be, and by soon I mean tomorrow, we are going to be accepting applications for the NNU's Leadership School. So we have put on, this will be the third one. This is a 12-week course from June 15th to August 13th, which will meet weekly on Wednesdays. And the focus of this leadership school is to train up a diverse group of organizers across the US who reflect the multicultural, multiracial, and multi-generational movement that we are trying to build. Nurses, students, teachers, community organizers, activists, and others from any struggle for social justice and any kind of different background are all encouraged to apply. We actually offer a longer and more in-depth version of this workshop on personal story in the leadership school. And the applications for the next cohort open tomorrow. If you'd like, you can fill out the interest form, which Alyssa just threw in the chat. Thank you, Alyssa. And you will be on the first to know tomorrow when the applications open. The next thing we'd like to invite you to is the National Medicare for All Fest on Zoom. This will be on Saturday, April 23rd at 3 to 5 p.m. Eastern. We are going to have speakers and art and music and more on this virtual hangout. We'll also share some of our plans to build support in states with at least one Democratic senator, as well as some of our other ongoing plans and ways to get plugged in. And if you don't live in a state with at least one Democratic senator, that is okay. We still need you to join this fest because we have ways in which you can get involved wherever you are. So please do RSVP. And then the last thing that I'll let you know about is our MFA 101 webinars. This is our very basic entry level webinar. If you'd like to learn more about Medicare for All, or if you know somebody who you think might benefit from a Medicare for All one webinar, or they might want to learn more, send them this link, ask them to sign up. And it's a really great entry point into our campaign. But yeah, like Alyssa was just saying before, we really appreciate you all joining us for this workshop today and for sharing, opening up like this and sharing a bit of yourself can feel really inspiring and empowering, but it can also be really hard. All of these emotions are okay to sit with. Please try to be gentle with yourself for the rest of the day. And if you can, please take a moment after this workshop, or at least after the conference, to just decompress a little bit. But yeah, remember, we are all in this fight together, and together we will win and make guaranteed healthcare a right for all in this country. So thank you so much. We can't wait to get to work with you, and have a good rest of your day.
Yeah, thank you all. Yeah, appreciate it. Let's win Medicare for all.
Woo!
Thank you.
Bye, everybody.
Take care.